Cardiac surgeon warns this vitamin seniors take daily harms the heart over time. A cardiac surgeon recently revealed a warning so unexpected that it's leaving many seniors stunned because the very vitamin meant to protect your health may quietly be harming your heart over time. Most older adults believe vitamins are always safe, gentle, and completely harmless. Yet the truth is that certain supplements behave differently once you cross 60. Your body absorbs nutrients in new ways. Your arteries respond more sensitively. And even small daily doses can build up where you least expect them. And among them lies one particular vitamin used by millions every morning that may slowly stiffen arteries, raise clot risk, and force the heart to work harder with every passing year. That's why today's video matters so deeply, because understanding these vitamins could help you prevent silent damage long before symptoms appear. By watching until the end, you'll learn 3 powerful things. First, which vitamins often cause hidden strain on the heart after 60. Second, how to use these supplements safely without giving them up entirely. And third, the early warning signs your body gives when a vitamin is no longer helping but quietly overwhelming your cardiovascular system. And pay special attention to vitamin 3 because almost every senior takes it daily without knowing how easily it can contribute to artery calcification. Before we go deeper, I would truly love to know where you're watching from and how young you are today because our community becomes stronger each time we connect across distances and ages. And let's make it fun. If you took any vitamin today, comment yes. If not, comment not yet. Your voice keeps this channel alive and your experiences help thousands of seniors learn and grow together. Now, let's start with the 5th vitamin. The one many seniors consider harmless. Yet, it can quietly raise your bleeding risk if you're not careful. Number 5. Vitamin E, high doses. Vitamin E has long been praised as the skin and heart protector, which is why so many seniors confidently take it every morning without a second thought. But what few people over 60 realize is that high-dose vitamin E works very differently inside an aging body, especially when it comes to blood flow in the heart. Vitamin E naturally thins the blood, a benefit in small amounts. But when taken at high doses, it can make your blood too thin, increasing the risk of internal bleeding. For a younger body, this imbalance is usually managed safely. But after 60, blood vessels become more fragile and far less forgiving. Even a simple bump or unnoticed internal bruise can become a slow, silent problem when vitamin E accumulates. Some seniors report dizziness, unusual fatigue, or easy bruising. Early signs that the vitamin is no longer helping, but quietly overwhelming the system. And because vitamin E stays in the body longer than most people think, daily use can slowly tip you into risky territory without any clear warning. This becomes even more dangerous if you're already taking blood thinners, aspirin, or medications for the heart, which can amplify the effect dramatically. What starts as a well-intentioned habit can snowball into a strain on circulation and a greater risk of heart-related complications. But the truth is, vitamin E isn't the enemy. Improper dosing is. Most seniors don't need high-dose supplements at all because normal foods already contain enough to support healthy aging. A simple shift to lower doses or food-based vitamin E sources can protect your heart while still giving your cells the antioxidant support they need. And once you understand this balance, vitamin E transforms from a hidden danger into a gentle ally again, exactly as nature intended. Number 4. Vitamin B6. Vitamin B6 is often seen as a harmless energy booster, which is why so many seniors take it daily without realizing how differently it behaves inside an aging nervous system. In small amounts, B6 supports brain health and metabolism. But when taken for long periods, especially in supplement form, it can quietly overwhelm your nerves. What many people don't know is that excess B6 can irritate the peripheral nerves that help regulate heartbeat and muscle coordination. And after 60, when nerves naturally become more sensitive, this irritation can lead to numbness, tingling, and even subtle changes in heart rhythm. Some seniors begin feeling off balance, unusually tired, or strangely jittery without linking those symptoms to their daily vitamin. For others, long-term B6 use causes the body to misfire electrical signals, forcing the heart to beat harder or less efficiently than it should. This is especially concerning because these symptoms develop slowly. So slowly that most people assume it's just aging. But the truth is that higher prolonged B6 intake is one of the few vitamins known to cause measurable nerve dysfunction over time. And once the nerves that guide heart function are strained, even mild stress or exertion can feel heavier on the body than before. The good news is that B6 is rarely harmful when obtained from food because your body regulates natural sources far more gently. It's the long-term supplements, often taken without clear guidance, that create trouble. Reducing the dose or cycling off B6 for periods of time can allow the nerves to recover and the heart to regain its steady rhythm. And when used wisely, B6 returns to being a helpful supporter of wellness rather than a silent source of strain. Number 3. Calcium supplements. Calcium supplements are one of the most commonly used vitamins among seniors, taken faithfully every morning in hopes of preventing fractures and keeping bones strong. But what most people never hear, even from well-meaning doctors, is that supplemental calcium behaves differently after 60, especially when it arrives in a quick concentrated dose. Instead of slowly absorbing into the bones like dietary calcium does, supplemental calcium can flood the bloodstream all at once. And when that happens, the body must decide where to put the excess. And too often, it settles inside the arteries rather than the bones. This is how artery calcification begins. Tiny crystals forming along artery walls, quietly stiffening them and forcing the heart to pump harder to maintain healthy circulation. Over months and years, this process can turn flexible vessels into rigid tubes, reducing oxygen delivery, and increasing the risk of clots, high blood pressure, and cardiac strain. Many seniors feel shortness of breath, chest heaviness, or leg cramps, and never suspect that their harmless calcium tablet may be contributing. What makes this even more concerning is that calcium supplements are often paired with high-dose vitamin D, which increases absorption further, sometimes too much for an aging body to manage safely. Food-based calcium never causes this issue because it is absorbed gradually in harmony with the body's natural pace. But supplemental calcium acts more like a surge, overwhelming both the bloodstream and the arteries. This doesn't mean seniors must avoid calcium entirely. It means they must focus on the right source and timing. Choosing smaller doses, taking them with meals, and relying more on dietary calcium can dramatically reduce arterial buildup. And with these simple shifts, calcium once again becomes a friend, strengthening bones without weakening the heart that carries you through every day. Number 2. Niacin, vitamin B3. Niacin has long been celebrated as the cholesterol vitamin, which is why so many seniors take it with confidence, believing it will keep their arteries clean and their hearts protected. But what most older adults don't realize is that niacin acts like a powerful drug at high supplement doses. And the aging heart doesn't always appreciate that intensity. When niacin enters the system in large amounts, it can dilate blood vessels too quickly, creating sudden warmth, flushing, and unnecessary stress on circulation. For a younger body, this is usually harmless. But after 60, when vessels become more rigid, that rapid dilation can feel overwhelming and leave the heart beating harder to stabilize blood flow. Some seniors experience palpitations, dizziness, or a strange pressure in the chest without ever linking it to their niacin tablet. Long-term high-dose niacin can also strain the liver, which plays a key role in managing cholesterol and maintaining balanced heart function. And when the liver becomes stressed, inflammation rises, creating a chain reaction that ultimately burdens the cardiovascular system. Even more concerning, new research shows that too much niacin may increase a substance called homocyan, a compound strongly linked to artery damage and clot formation. This means the vitamin intended to lower heart risk can sometimes raise it instead, especially when taken without medical guidance. Food-based B3 found in fish, poultry, and whole grains doesn't cause these issues because the body absorbs it gradually and safely. It's the large supplemental doses often taken daily by seniors that create the hidden danger. The solution isn't fear, it's awareness, balance, and individualized dosing that respects the needs of an aging heart. And with the right approach, niacin can return to being a helpful ally rather than a source of silent stress. Number 1. Vitamin D. Vitamin D is often called the sunshine vitamin, and many seniors take it daily, believing more will always mean better bone strength and better immunity. But that's not how the aging body works. After 60, your kidneys, arteries, and calcium regulation systems become far more sensitive, which means vitamin D can easily become too strong if taken in higher unbalanced doses. Unlike other vitamins, vitamin D directly controls how much calcium your body absorbs. And when levels rise too high, the bloodstream becomes overloaded. That extra calcium doesn't simply disappear. It looks for somewhere to settle. And too often it deposits inside the arteries instead of the bones. Slowly, silently, this leads to artery calcification, a hardening of the vessels that forces your heart to work harder with every beat. Some seniors notice subtle symptoms like fatigue, muscle cramps, or chest heaviness, while others feel no warning signs at all. Yet, the calcium buildup continues day after day. The danger grows even higher when vitamin D is taken with calcium supplements, creating a powerful combination that overwhelms your natural balance. And because vitamin D stays in the body for a long time, even mild overdosing can accumulate quietly over months. Blood pressure may rise, arteries may stiffen, and clot risk increases. All from a vitamin most seniors assume is completely harmless. But the truth is that vitamin D is incredibly beneficial when used wisely, especially in small, consistent doses that match your actual needs. Sunlight, gentle movement, and food-based vitamin D sources work with the body rather than against it. Testing your levels and adjusting your dose can protect both your bones and your arteries, ensuring that vitamin D becomes a helper, not a threat. And when balanced correctly, it supports your heart, strengthens your muscles, and keeps you steady and vibrant in every season of life. Conclusion: understanding these vitamins isn't about fear. It's about giving your heart the clarity and protection it deserves as you grow older and wiser. Your body after 60 doesn't need more stress, more pressure, or more guesswork. It needs gentleness, awareness, and choices that truly support your long-term strength. And now that you know which vitamins can quietly burden your heart, you're already far ahead of most people your age. Every small adjustment, lowering a dose, switching to food sources, or simply checking your levels becomes a powerful step toward healthier arteries and steadier circulation. Your heart has carried you through every joy, every challenge, every season of your life, and it deserves care that honors all those years of service. Never underestimate how quickly your body responds when you treat it with intention instead of routine. What felt heavy can become lighter, what felt tiring can become manageable, and what felt confusing can become clear the moment you understand what your body truly needs. These insights aren't just information. They're tools that help you age with confidence, independence, and peace. And you are never too old to make a change that protects your future. If today's video opened your eyes or taught you something new, let me know in the comments and tell me where you're watching from and how young you feel today. Your stories inspire others to take their health seriously, one small step at a time. If you haven't subscribed yet, I'd love to have you join this growing community of strong, motivated seniors who want to live fully, not fearfully. Share this video with someone you love because one simple piece of knowledge may save their heart without them ever realizing it. Thank you for spending this time with me. Your health matters, your choices matter, and your journey matters. Wishing you steady strength, calm days, and a heart that stays healthy for many beautiful years ahead.